Good evening and welcome to our COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Today, Commonwealth Secretary General gives hope on COVID-19, says the world would overcome it. Extended flight restrictions into Nigeria take effect today as Presidential Task Force warns against flouting COVID-19 guidelines. And 10 workers of the Lagos State Governor test positive to COVID-19. Sanwo-Olu and his wife test negative. And France begins gradual easing of lockdown measures. Now, all the Nigerian evacuees who arrived from the UAE with the Emirates Airlines have been placed on compulsory quarantine. They are to remain there for 2 weeks, and the NTDC is expected to take their blood samples for 2 weeks until a second test is conducted. The worry now is that if one person tests positive, all of them will be placed in further isolation for observation until all turn negative. At the moment, the 256 evacuees are isolating at 2 separate facilities. For those coming in from New York and the UK, it's a different ballgame entirely. While some of the Nigerians willing to return from the United Kingdom are said to have tested negative, most of them are going to embark on that journey without being tested, while those from the United States are not likely to be tested before they embark on the journey back home. Our theme this evening, we x-ray the implications of their return. Nigeria now has a total of 3,145 COVID-19 cases following confirmation of 195 cases by the Nigeria Center for Disease Control last night. The NCDC also confirmed that 534 patients have been discharged from various isolation centers and a total of 103 deaths recorded. A breakdown of the 195 new cases show that 82 are in Lagos, 30 in Kano, 19 in Zamfara, 18 in Sokoto, 10 in Borno State, 9 in the FCT, 8 in Oyo, 5 each in Kebbi and Gombe, 4 in Ogun State, 3 in Katsina, 1 each in Kaduna and Adamawa State. The nation's commercial capital, Lagos, remains the state with the highest infections, both in the southwest and the country, with a total of 1,308 cases, followed by Kano in the northwest. Thereafter, the Federal Capital Territory in the north central maintains third position with 316 cases, while Borno has the highest figure in the northeast, followed by Edo and Enugu states, which still leads the south-south and southeast with 65 and 8 cases. Nigeria's President Muhammadu Buhari has approved the waiver of import duty and value-added tax (VAT) for critical medical equipment and supplies. The president today said the waiver will be for a period of 6 months in the first instance, with effect from the 1st of May 2020. This is coming as the country battles its share of a global pandemic and low medical supplies. The Commonwealth Secretary General, Patricia Scotland, has given a strong hope to the world on the fight against COVID-19. She says COVID-19 will surely be defeated. I spoke to her earlier in an exclusive interview on Skype today, where she also talked about the need for the Commonwealth countries to come together to forge a strong link to help integrate the Commonwealth as one people.
My major thing to say to everybody is we can do this. The last generation that was faced with something as awful as the pandemic were in the 1940s during perhaps the Second World War. The Commonwealth came together then and we fought together and we won. I think we can be a beacon yet again and to show the way. So a big thank you for Africa, big thank you to the President and the Cabinet, big thank you for the leadership and the solidarity. I believe that together we will succeed. We can't do it on our own, but I'm confident we can do it if we stick together. Well, one of the good things about our Commonwealth is we are 54 countries, that's 2.4 billion people, and 60% of our people are under the age of 30, so we have a powerhouse. But the things that join us are really important. We share the same language, the same common law, similar structures in terms of governance. And that gives us a 19% advantage when we trade with one another. Our systems reflect one another, and there's a great deal of compatibility. So over the years, we've identified this Commonwealth advantage for doing business, and we've been able to start now to positively exploit it. Up until last year, we identified that the amount of trade between our Commonwealth family of 54 was $700 billion. We anticipate that it may be possible to increase that to $2 trillion by 2030. And this opportunity is made even more sharp by two things. The first is we have the World Trade Organization's Trade Facilitation Agreement. And because our systems are so similar, and because we've got this 19% advantage, and we settle our disputes 20% more quickly, we can work together to make sure the boulders that are getting in the way for our trade can be moved out, and so that we can accelerate the amount of trade between us. So that's one. But the second, which is even more important, particularly for Africa, is the creation of the African Free Trade Area. And that, you know, was agreed, and it was supposed to come in July, and we're hoping that it still will do. But Nigeria has done a great deal on that, but we know so has the other AU countries, and that Ghana is going to have the secretariat. So we here in the Commonwealth not only helped to facilitate that in the AU by giving our expertise and our experts, but we have continued to commit to the African Union and to the African Free Trade Area to try and make sure that we can ease the trade between us. And we're going to need that trade, and we're going to need that acceleration even more.
Commonwealth Secretary General Patricia Scotland speaking there. Now, one thing you cannot take away from the Presidential Task Force is their willingness to give information almost on a daily basis. At the media briefing today, the Secretary to the Government of the Federation said the extended flight restrictions takes effect today, just as he warns against flouting of precautionary guidelines against COVID-19.
To underscore the danger, non-compliance is manifesting in several ways and could be costly in the future. Reports from various parts of the country at the close of yesterday's 6th May 2020 indicate the following. High level of non-compliance with the ban on interstate travels. This resulted in a high number of vehicles finding their way across many state borders despite the curfew and border restrictions. It is worrisome, however, to note reports received about isolated cases of compromise by some security operatives. We urge the various commands of the security agencies to enhance their monitoring machinery to ensure that we do not only achieve the objective of stopping the spread of the virus, but also prevent the good name of the services from being tarnished. The Presidential Task Force has become aware of a number of challenges associated with the management of the isolation centers. These have manifested in the form of protests over welfare, abscondment from centers, and loud complaints based on the assumption by persons under observation that drugs must be administered. The first two are unhealthy developments capable of undermining the containment measures and putting the lives of care managers and frontline workers at risk. Similarly, persons in isolation are encouraged to follow the direction and instructions of the experts during their stay as treatment to be administered will largely depend on the evaluation of the doctors. However, we urge all state governments to continue to pay attention to the welfare of people in isolation and for security agencies to provide adequate security around such facilities to prevent escape. For some time now, there have been claims of inventions and cures related to COVID-19. The Presidential Task Force, as part of its mandate, remains supportive of and receptive to outcomes of research. It, however, finds it imperative to reiterate its position on the need for such discoveries to undergo the scientific validation processes.
The Minister of Health, Dr. Osage Ehanire, took a moment to praise the frontline health workers, even as he cautions them to ensure that preventive measures are taken by them in order not to get infected while treating others.
The Ministry of Health task team to Kano is collaborating intimately with the state government and is fully engaged in remediation activities which strongly emphasize training and capacity building for all personnel in order to help rebuild the manpower in the state and also in federal health facilities there. These include also non-medical personnel like the cleaners, porters, security guards, especially those in the COVID-19 isolation and treatment centers. The intensive training is essential to minimize the risk of infection of personnel in the line of duty, which is becoming a major challenge in various parts of Nigeria. I want to appeal to all our returning citizens to bear with us and to cooperate with authorities and to be patient, especially if they perceive imperfections in arrangements, as this is a test run, the first in these exercises.
For the Director General of the NCDC, Dr. Chikwe Hekwazu, the concern is about the safety of health workers.
As it relates to road.
Some of them are obvious, that every business should invest a little bit in hand-washing facilities and sanitizers. These are small things that are not hugely resource-intensive, but they can save lives. And we're not just talking about the corporates. I'm talking about the guy that owns a small shop selling foodstuff. There's no reason why you can't invest in a small bottle of sanitizer. So if your customers come to you, say, listen, before we transact this, I sell plantain to you this afternoon, please let me make sure your hands are clean. Small things like that can save lives. In offices, display signages reminding staff about the need to wash their hands. We're all human. We will forget. So small prompts to remind us about when and how we should wash our hands. Discourage the sharing of work equipment. And this is very hard because we do a lot of this. We share tools all the time, whether they're pens or computers or even the sanitizer bottles. If you want to give other people sanitizers, ask them to put out their palms and you spray your own sanitizer on their palms.
10 persons associated with Lagos State House in Marina have tested positive to COVID-19. The Commissioner for Health, in a tweet today, announced that the Governor of Lagos State, Babajide Sanwo-Olu, and his wife have both tested negative consistently to the coronavirus following 3 tests conducted on them recently. Professor Bayomi called on all to continue to use the face mask and all other precautionary measures in fighting the pandemic. Still to come on our COVID-19 pandemic update, we have more on the measures of states across Nigeria to stopping the spread. Do join us again. Welcome back. Let's take you across a few states and some of the measures to curbing the pandemic. 2 more positive cases of the coronavirus have been reported again in Niger State, bringing the total number of confirmed cases in that state to 8. The Commissioner for Health, Dr. Mohammed Mukasidi, who disclosed this, said one of the new cases is the husband of the only woman at the isolation center from Suleja and a returnee from Kano. Now, Yobe State government received a batch of 51 Almajiri from Nasarawa State. The vice chairman of the Yobe 20 COVID-19 committee and commissioner for health, Dr. Lawan Ghana, said the returnees will be quarantined for 14 days before being allowed to join their families. And 16 out of 45 Almajiri results have come in positive in Jigawa State. Chairman of the state's task force on COVID-19, Dr. Abba Zakari, in a briefing at the NYC camp Kiawa, said the remaining 29 children that tested negative will be allowed to go home and will be given 10,000 naira and clothing. Meanwhile, the committee in charge of investigating the mysterious deaths in Hadejia says they have counted 92 corpses buried within a week in the local government area. Only one of the deceased has symptoms of COVID-19, and they have already advised the family to be quarantined until they get tested. And over in Abia State, the COVID-19 task force today apprehended some persons suspected to be Almajiris at Ariam Ikwano local government area border with Akwa Ibom State. According to the Commissioner Homeland Security, the Almajiris came into the state in a truck meant to carry cement. He said they would be sent back to the place where the truck brought them and the driver to face a mobile court. And finally, Ogun State government says it discharged 6 patients from its isolation center in Ikenne after they tested negative twice. This brings the total number of discharged cases in the state to 20. There are currently 73 active cases who are currently receiving treatment at isolation centers in the state. The chairman of the Nigerians in Diaspora Commission, NIDCOM, Mrs. Abike Dabiri-Erewa, says government is doing all it can to ensure that the evacuees get all the attention during the isolation period. She told Channels Television in an interview today that more of the returnees will arrive next week and arrangements are being made to receive them.
Day is actually Friday, tomorrow. I hope nothing changes, but the proposed date now is Friday to arrive in Lagos and then proceed to Abuja. That's what the cost catered to the passengers. For the US is 9 or 10, but I think it's about 9 on the paper now. So it's either 9 or 10. So those are the 2 on the calendar for now. And then next week there's likely to be another flight from the UAE. So those ones are the ones that are on the calendar at this point in time. That decision will be taken by the Minister of Foreign Affairs in consultation with the Presidential Task Force. Don't forget that arrangements need to be made here for the compulsory isolation, and I'm sure you know that we don't have all those places. So it's going to be in consultation with the Minister of Foreign Affairs and the Presidential Task Force, whatever next steps will be taken. Those who return from Dubai are already on the 14-day isolation in about 2 different locations in Lagos. And those coming Friday have been taken care of. They will be in Abuja. And also the ones from the US, I think will also be in Abuja.
Well, more on perfecting the arrangements, we have Dr. Ogbonnaya Iheme, Medical Director, Prime Care Hospital. He joins us from our Abuja studios. Welcome to the program. I must begin by asking the protocol for COVID-19 in your hospital. Are you making it compulsory to wear face masks before you attend to a patient?
Yeah, definitely. Good evening, Millicent. Face mask, of course, has, just like the federal government and then other state governments have also, as much as possible, tried to make face mask, a policy, as part of the strategies in, curbing COVID-19. We also have extrapolated that same practice in our various practices. As much as possible, not only are we looking at improving, safeguarding the lives of the employees, but also of the patients that are also coming.
So let's look at perfecting the arrangements of those being evacuated back, willing Nigerians coming back here. They're being expected and some have already arrived. But from what we gather, some of them, especially those coming in from the US and possibly the UK, may be evacuated without undergoing COVID-19 tests. Is this something we should be concerned about?
Definitely, it's going to militate so much against whatever efforts, whatever successes we have recorded as far as the fight against COVID-19 is concerned in Nigeria. We have always emphasized on the need for as much as possible to test, continuous testing. So if you say you are bringing in people to evacuate people from all over whatever part of the world, and most especially where that these countries have very high areas of interest of infection, as far as COVID-19 is concerned. I mean, if you do not test them and know their status, and you just evacuate them and allow them to mix with the general population, even if you said you are doing quarantine without doing testing, I mean, I think it's something that will still be a sort of worry to us as citizens.
What sorts of medical procedures would you say that the evacuees should go through before being allowed to board the plane and then coming into Nigeria?
No, as much as possible. All of them, even though normally most authorities will talk about testing the ones that are showing symptoms. But I think that because they are coming from high-risk areas, all of them should be subjected through the test, the routine test, the normal test. Now, we are talking about the PCR. Now, the PCR is said to be the gold standard. PCR, by the way, means polymerase chain reaction form of test, which one basically focuses on the protein, the DNA protein, the protein of the virus itself, which shows that it is available, it is there. When it's there, it's there. Now, if it's able to show positivity, it means this patient is positive, and so I think they should be subjected to PCR test, at the point of entrance, and even at when they get into the country, as much as possible, just to make assurance doubly sure. Before, if one is now negative, I still think as much as possible, because returning from that high level, a place of high level of infection, they should still mandatorily go through self-isolation. Just like the government has always been talking about before they are released to the community.
All right, we appreciate your time, Dr. Ogbonnaya Iheme, Medical Director, Prime Care Hospital. Thank you for joining us on the program.
My pleasure.
And on the international scene, French Prime Minister Edouard Philippe today detailed his government's plans for easing COVID-19 lockdown measures on May the 11th, warning that the exit from the restrictions will be gradual and targeted to stem a resurgence of the viral outbreak. He confirmed that May 11 will mark the beginning of a progressive exit from lockdown, ending almost 2 months of strict confinement for France's 67 million strong population. And from the Nigeria Center for Disease Control, you can access the revised guidelines for businesses to operate smoothly during this period. The center continues to work closely with states. You can find the latest national strategy to scale up access to testing in Nigeria and other public health advisory. Let's take you to the live feed of the World Health Organization, the website Each Moment, regular updates about the spread of the pandemic and several guidance for strategic action that is tailored to local context. Well, that's our COVID-19 edition on Channels Television. Another update comes your way again at 9 p.m. I'm Millicent Nwaka. Stay safe.